something to smile about comes from Galatians 6:2, and it reads, "Carry each other's burdens, and in this way you will fulfill the law of Christ." Now that's something to smile about. Hi everybody, welcome back to the RDH Encore channel. If you're new here, my name is Nikisha and I'm a registered dental hygienist. So today I want to talk about some of the frequently asked questions that patients ask. There are many questions that patients ask me on a day-to-day basis. So I wanted to address some of these frequently asked questions so that the average person watching these videos would kind of have some of their questions answered no matter what dental office you go to or what hygienist or doctor that you see. And these are in no particular order, by the way. So I'm just going to include 3 questions for this particular video, and I probably will do a part 2. So the first question that I hear quite a bit is, what if I wait? So this question is usually in response to the doctor diagnosing something or me maybe doing an evaluation on their gums and saying that they have periodontal disease and that they need a certain treatment, or the doctor basically saying that they need a crown or an extraction or some type of restoration on their teeth. So patients begin to ask, what if I wait? They don't want to go on with the treatment at the time, so they want to know, what if they wait? So in the field of dentistry, waiting could cost you lots and lots of money. It could cost you a tooth. It can cost you quite a few teeth. It just depends, you know. It can always make the condition worse, basically. So for example, if you're being diagnosed with periodontal disease and saying that you need scaling and root planing, which is, you know, usually called a deep cleaning, then waiting on a treatment like this can cause your bone level to continue to recede, and you can continue to have more and more bone loss, which could cause you your teeth. I mean, your teeth can become mobile and they can come out just depending on how the disease has already progressed at the time of being diagnosed. And also it just depends on the person as far as how fast it progresses. And so having periodontal disease and not treating it, it can cause you your teeth, it can cause mobility, it can cause pain. It can also cause the aesthetics, you know, to be worse and worse. It could be the early stages of gum disease, and then you can get to the point of, you know, your teeth starting to look long, your root being exposed, having bad breath. You know, it can cost you a lot. So if you wait on that type of thing, then that could, you know, cause you all kinds of issues. Another example would be that a simple filling could turn into a larger filling. So like if you have a 1 surface filling that needs to be done, it may turn into a 4 surface filling by your next visit, or a year later when you decide to get it done. Also, fillings can turn into needing root canals because the decay could go into the nerve of the tooth, and it can cause you to have a root canal. It could also, a simple filling could turn into a crown just by covering most of the tooth. And so you would need full coverage, or the tooth would be, you know, not as stable as it should be. Without doing a crown, you would not be able to do a filling anymore. You would need a crown. Another thing would be, basically, if you just let a regular diagnosis of needing a filling done go for years and years, or even a diagnosis of needing a crown done, if you continue to let that go, it can always get worse, and you could possibly lose the tooth. It could be non-restorable, and we would have to extract the tooth, or the tooth could simply decay out and just come out. I've seen that plenty of times. So those are all things to consider when asking the question, what if I wait? It's usually better and more cost effective to go ahead and get those things taken care of. A lot of times dental things or dental issues do not come up whenever you have the money, or whenever it's just the most convenient time to be off work, or whatever the case may be. You may have a busy schedule and not have time to get it done. Just whatever your issue is with it, it's best to go ahead and try to make the time. Go ahead and save the money. Go ahead and do what you need to do in order to get it done, so that the problem doesn't become a bigger problem. So that is frequently asked question number 1, what if I wait? So frequently asked question number 2 by dental patients is, why do you do that thing where you stick my gums? So usually this is in reference to when I'm doing my yearly or my initial probing. A lot of patients are not accustomed to that when coming from another office, or if they're younger and have never had it done before. So basically this is probing. This is there is a probe, and I'll put one on the screen here. It is a dental instrument, and it looks like it's sharp, but it's really blunt unless your gums are super inflamed, then it can be a little hypersensitive. But basically there's calibrations on the end of it. So basically I stick it at the base of your gum tissue all the way down between your teeth and gums, and I measure all the way up to the top of the gum tissue where the gum tissue stops. And so that gives me a measurement, and any measurements between 1 to 3 millimeters is considered healthy. 4 is considered gingivitis, which includes redness, bleeding, and inflammation. And 5, 6, and above, any of those numbers indicate periodontal disease or bone loss. In some of those cases, it can also mean that you have like pseudo pockets and it's extremely inflamed. Either way, it needs to be addressed. So basically you want to keep those numbers between 1 and 3 millimeters for healthy gums. So we do this test at least once a year in order to determine the areas where the patient needs to kind of increase their home care or focus their home care. Also, it helps us to identify whether the patient has periodontal disease or gingivitis, or what type of gum disease they have and how we need to go about addressing it. So probing isn't done with the intention of being torture for the patient at all. It's simply done in order to evaluate so that we have records to look back at, see where things were this time last year or this past visit, just so that we can compare, and then we can also have the data there to see, you know, what range it falls within and what your actual diagnosis is concerning your gums and your bone. So in order for this probing assessment to be successful and to actually help, behavior modification is usually indicated. This means changing your behavior and adjusting to what the hygienist identifies as being your problem areas and focusing more on those areas and just doing what she recommends that you do in order to get those areas in a better state. So question number 3, that's a frequently asked question by dental patients, is why do you blow air? And this is usually in relation to whenever I'm cleaning, usually on the lower anterior teeth, which is the lower teeth here in the front. I will blow air because those areas collect a lot of tartar, the white hard substance that gets on your teeth, usually on the tongue side of your teeth, right inside there. Usually it collects a lot of tartar because of the main salivary glands that's underneath your tongue, and also the areas right here on the cheek side, on the upper, on each side here, near your first and second molars back here. The parotid gland, which is a salivary gland, it also builds up tartar in some people. So if there's any plaque present over a period of time, and it doesn't have to be a long period of time, if there's any plaque present over a period of time, those areas can calcify, it can harden up due to the calcium that is included in the saliva that is released out of that salivary gland, and those salivary glands up here. So basically, in short, I blow air. So I went all around town just to kind of explain that these areas collect a lot of tartar, and so whenever I'm cleaning the areas in order to check my work, I'm simply just checking my work. I'm blowing air because in those areas, when I dry them off, they look white and chalky. If I still have white and chalky areas, then I need to do more scaling and I need to clean in that area a little bit more. So it's simply a way of just checking my work. I get that question quite a bit from patients. I know that all hygienists don't do that, but basically we're just blowing off the tooth. We're blowing the air in order to dry off the area to be able to see things better. Doctors will do it a lot of times, and even hygienists whenever they're looking for suspicious areas. Maybe some areas on the biting surface of the teeth or any other part of the tooth where you can't see well, or if you need to get a picture in that area, you have to be able to blow the air there in order to dry the area off so that you can see whether there's a cavity there or if there's an area of concern. So basically we're just blowing and drying the area off so that we can see the area better. Well, those are all of the frequently asked questions that I'm going to share today. Actually, like I said, I'm going to be doing a part 2 because I feel like this will be a great way to answer questions that patients frequently have. You know, that way you can watch these videos and kind of find out the answers to these questions. If you enjoyed this video, please give it a thumbs up and like this video. Also, if you have any questions or frequently asked questions you'd like included in any of the other videos, please leave a comment in the description box down below. And also, if you haven't already become a member of the RDH Encore family, please hit the subscribe button and also hit the bell so that you can be notified whenever any videos are uploaded to this channel. So thank you so much for watching. This is all that I have for you today. And until next time, everyone, take care and remember to let your smile shine. Bye.